Welcome back. Many of us hate visiting our gynecologist, but so we brought him in-house for you. You can ask all your questions. We're going to get them answered by Dr. Sherry Thomas, board-certified gynecologist at Mission Community Hospital. Thanks for being here.
Oh, thank you for having me.
Well, so let's just talk about the thing most of us women don't love, our menstrual cycles. How do we know when they're abnormal?
Well, that's very interesting because when we start having periods, the first year to maybe 5 years, they take a while to kind of regulate. And then we have regular periods, whether it's every 21, 28, 30. You fall into your cycle where you know every month about when it's going to occur, and you have it for maybe 3, some people shorter, 2, some people go 7, 8 days. But that's a normal period. When your periods start getting longer, more days, becoming more frequent, maybe every 2 weeks.
Oh boy, do people have that? Oh, that's not fun.
I knew somebody who had them every single day for many, many, many years.
That is a problem.
So hopefully that person, after you're on your second week of having bleeding, you call your doctor.
Yeah, right. Did she just keep going on?
No, she was taking the pill.
Okay.
Eventually she started taking the pill to try to suppress the blood.
But you know something's wrong when you're still bleeding. 2 weeks later, I mean, you're on the phone to your doctor, and if that doctor doesn't help, you get another. Because really, we as women, we don't want to keep bleeding forever. And
no,
we
certainly don't. We certainly don't.
You can say that again.
Right the day we stop.
But so, what about when we get older? I mean, it does change. So how do we know, like, okay, it's just changing and it's fine, or no, this is a problem?
Well, that's a good point, because when we get older, we start getting periods a little bit closer together. So it's 28 days, maybe 25, 24, and then we might miss a period or two, get a few hot flashes. But our periods shouldn't get heavier. They shouldn't get longer, and we should not spot in between. That's clearly abnormal, and that's a good reason to call your doctor, because we want to make sure there's nothing serious going on like a cancer.
Now with that, you know, there's this talk about pap smears going every 3 years as opposed to annually. So how does that play into the mix if, you know, you have abnormal period, but they're saying you should only do a pap every 3 years?
Right, so the pap smear every 3 years, but the pelvic exam every year.
Okay.
Oh, so you're still going in.
So you're still going in. Okay, good.
Is there a difference if you're like not having sex, or if you're just with your husband, or as opposed to someone who's dating and lots of partners, as far as what you should be doing health-wise as far as seeing the gynecologist?
Oh, absolutely. If you're seeing several partners, maybe you're not always protecting yourself from sexually transmitted diseases with a barrier, you may want to go in more frequently, especially if you think you might be catching something, have an abnormal discharge. And in terms of the bleeding, you know, you want to see your doctor right away when you start having anything abnormal.
Now, what about in teens? Because they're starting their menstrual cycle, and you know, when it first starts, it's a little irregular. So how do they track a pattern?
That's so interesting, because that's the most common time of having abnormal periods, because they'll release an egg and then start having a period, and then it may take 6 months before they release an egg again. And when they release the next egg and have a period, they may have very heavy bleeding. So if you have a daughter who's having irregular bleeding, take her right away to see her doctor so she can get that regulated, because it's so uncomfortable for her to have now a 30-day very heavy period where she may become anemic.
Well,
oh, no, I just had a question. You know, you always hear that there's like a bunch of girls together, and their periods end up coming at the same time. So why would this be, and is this true, or is this a wives' tale?
That's not a wives' tale, because we all get on the same hormones, if you will. We get on the same type of moods. So we all may ovulate at the same time. And the other thing is during stress, we stop having periods because we're so stressed. For example, many of the women in our residency, in medical school, we stopped having periods because we were so stressed. So we were all in the same.
So who did you guys go see?
Yeah, exactly.
Doctors are sometimes the worst patients.
We were a little busy working.
Yeah.
You know, Dr. Thomas, going back a little, how should parents prepare to have that conversation with their teens? Because we talk about, oh, my daughter, she's about to start, but what type of conversation should we be having?
What a great
Well, you know
question.
what? We are going to come back with that conversation because we're just going to take a quick commercial break. We'll be back with more Every Way Woman.
Yeah, that's a good question.